Assalamu alaikum, I'm Dr. Tahira and you're watching PTV World. Program is Health is Wealth. Today is 28 July. It is World Hepatitis Day and that is why we are wearing green. You know the jade ribbon, the green ribbon that speaks about hepatitis B and C awareness in particular. Today's theme is hepatitis and that is why we are present here with hepatologist and gastroenterologist Dr. Hyder Abbasi. Let us watch this show so we can fight this latent killer today itself. Assalamu alaikum, and today we are commemorating World Hepatitis Day 28th of July, and that is why we thought why not be with a hepatologist and gastroenterologist. We have with us Dr. Hyder Abbasi. Thank you so much for joining us, Dr. Hyder. How are you doing today? So today is World Hepatitis Day and especially Pakistan is affected with hepatitis at a very large scale. We've been trying to battle this disease for so long. So what is the reason that people over here do not go for hepatitis B or C testing?
Thank you for having me on the show and to discuss this important topic of hepatitis. 28th July is celebrated as World Hepatitis Day. And the purpose of this is to create awareness among people to get them self-tested and obviously then treated and vaccinated. This year the theme is again, it's time for action, take action, test, treat and vaccinate. Regarding the question you asked that why people don't get screened for hepatitis, because hepatitis B and C, which usually cause chronic hepatitis, they don't have any
signs and symptoms.
Obvious signs and symptoms. That's why people don't get tested for it until the disease is advanced.
So is this why it is called the silent killer, and they say, you know, it's there inside your body, you've been infected but you just don't know because there are no signs and symptoms, and then it just stays inside your body for so long and then one fine day it presents or manifests itself as hepatic carcinoma. Is that the case, and how many years does it take for it to manifest itself?
Yes, exactly, because hepatitis B and C, they are called silent killers because they don't have any symptoms, and let me tell you that hepatitis is one of the most deadliest virus in the world after COVID-19, and it is a leading cause of liver cancer. So the problem is that there are no specific signs and symptoms. People as a research showed that 9 out of 10 people living with hepatitis don't even know that they are infected.
And isn't it strange that they don't know they are infected, and then when they apply for a visa somewhere elsewhere for Umrah or for going for any tourist visa or education visa, then they get rejected on the basis of hepatitis C, and then they come to you for this treatment. And how long does this treatment take?
People who apply for visa or jobs and they get rejected, I think they're lucky in a way that at least they get screened and they get treatment accordingly. Regarding treatment, hepatitis C, usually the treatment is 3 months. It can range up to 6 months, but very effective oral antiviral medicines are now available, and the results are very good.
So one does not have to take those cumbersome, expensive injections called interferons like before?
Yeah. Now injections are no more needed, and these anti-oral viral anti-medicines are available, and the results are very good. Plus, there are no significant side effects, so people are very comfortable. The important thing is to get screening.
Okay, regarding so when we talk about screening, you can complete
regarding
that first.
Hepatitis B treatment, again, oral antiviral medicines are available, but that is a bit difficult to treat because you have to take the medicine for a long time. Like in hepatitis C, we have a specific duration that you have to take medicine for 3 months or 6 months maximum. In hepatitis B, sometimes we have to continue the medicine lifelong. But it is important to get screened and treated, because if you don't get treated, the end result is, the liver cancer.
So when we talk about screening, what are these tests? Because we know there's one test that's really cheap and you can get it tested for hepatitis B and C, and then there are some detailed tests called PCR and quantitative, qualitative. And how do you tell that the treatment has been successful, and how often do you keep checking after that, and is it via blood or anything else?
Regarding screening, I think this World Hepatitis Day is an opportunity to get ourselves screened. Everyone should try to get themselves screened at least once a year. And you don't need any expensive tests. You can just get screening hepatitis B and C test. And if they come positive, you can get tested by
PCR.
ELISA, or if they are positive, then you can go for PCR. After PCR, your treatment is decided.
So this polymerase chain reaction and qualitative, quantitative, what's the difference between this?
Quantitative basically tells you exactly the quantity, the viral load, while the qualitative only tells it is positive or not. Once you are treated, then again we do the PCR test to make sure that it is eradicated.
And this hepatitis B and C, the dangerous one, how is it spread? What are the ways it's spread? Because in Pakistan especially, all these parlors are using manicure, pedicures, the barbers, the syringes. What else are the ways of spreading?
Yeah, this is very important because preventing the spread is more important than the treatment, because it's not easy to screen whole population and then treat them. So it is basically hepatitis B and C, they both share common route of spread. They are spread by blood and blood related products. Whenever you get any surgical procedure, you go to even you go to a dentist, make sure that you get it done from authentic medical facility with good sterilization. Similarly, you should be very careful in blood transfusion. It should be from authentic facility, and again sterilization should be screening is must. Then regarding parlors like nose piercing, ear piercing, even if you go to barber, make sure that he uses new blade always. These are the things.
And the syringes, the used syringes.
Yes, and I think we should educate people to avoid syringes and drips, because it is a common concept that when people visit emergency departments, they don't go home until they are given drips, because we believe that when we get injection or drips, only then we will feel good. But 90% or 80% of the times you don't need injections or syringes. If you can take medicine orally, don't force the doctor or the staff to give you injections.
Dr. Hyder, this is a very important point, because nowadays there's so much of aesthetics in the market, and everybody and anybody is doing aesthetics, and they're injecting glutathione drips at home and doing it with the same set for everybody. Can you please again ascertain the need of people to understand that IV is only an emergency for people who cannot take something orally?
Yeah. Yes, this is very important because this IV route is the most important spread of hepatitis, because you see people who get lot of drips or a lot of blood transfusion, they are usually positive for hepatitis B and C. So like you mentioned about different products people are getting these days, we should avoid IV intravenous unless it's an emergency. And even if you still go for it, make sure that it is from a good facility, and sterilization is...
So autoclave, sterilization and taking your own instruments is always an ideal choice, or trusting somebody who takes care of these. What about the maternal fetal route from mother to child? Is it spread that way, and is it spread via sexual relations or not?
Yeah. Yes, it is spread via sexual relations as well, so people should be cautious about that, especially when someone is screened and tested positive for hepatitis B or C. We advise that you should use protection until the spouse is vaccinated, because this is very important. When it is transmitted from between husband and wife, then it will go to the whole family. So regarding children, that is also very important. It is an important route of transmission from mother to child. So for hepatitis C, we treat the patient, and as the duration is limited, like 3 months or 6 months. For hepatitis B, if the patient needs treatment, we start the treatment. And in case if she does not need treatment, even then during pregnancy, during the last trimester, we start oral antivirals to reduce the spread. And as soon as the baby is born, we advise injectables to protect. Immunoglobulins are given to the baby along with the vaccination to protect and to limit the
spread of. So what about the vaccine? Is there a vaccine for hepatitis B, and what is the ideal time to take it? How many times do you take it? What kind of vaccine is it? Is it safe, and who do you advise it to?
So far no vaccine is available for hepatitis C,
Okay.
but the good thing is we have effective vaccination for hepatitis B.
Okay.
But the important thing is to first get yourself tested. If you are positive, then go for treatment. If you are negative, then go for vaccination. 3 doses are usually given, and now it is included in our EPI schedules.
Okay.
So our children are getting these vaccines. But previously it was not included, so adults should get tested for hepatitis B, and if they are negative, they must get this vaccination. And it is not very costly. You can get 3 doses, and then you can get your test to make sure that you have developed sufficient antibodies.
So Dr. Saab, we have so many healthcare workers, so many people in this hairdressing industry, butchers, everybody who is constantly getting cuts and braces and even walking outside, and they're subject to this hepatitis C. So what would you advise to them? Like, how often do they get screened so that we can actually, have this mode of action, or time for action can be actually practical?
Actually, as I mentioned that there are no specific signs and symptoms like in acute hepatitis, which is hepatitis A and E, we have the symptoms are very evident, so it is very easy to pick them. For hepatitis B and C, we can only pick it via screening. So I would recommend at least once a year they should get screening. And I must mention that now the government of Pakistan is very interested. And the Prime Minister has started an initiative regarding hepatitis C elimination program. Okay. And the program is that all the population above 12 years, they will be screened for hepatitis C.
And they tested for free, and I believe that if they are positive, then they are actually given those medications for free as well. Yeah. Right?
So this project is in the pipeline, and it will be a good initiative because if you go to hospitals, most of the patients in emergencies, you will see that they will be suffering from complications of hepatitis.
Yes. And if a person does develop hepatitis, they had it inside, it's a latent disease, it was killing it, they didn't know, and finally it developed into a hepatic carcinoma or full-blown hepatitis. So how do they present? Do they have jaundice and nausea, vomiting, ascites? How do they present? And what is the prognosis of that liver carcinoma?
Actually, patients usually present when they develop the symptoms, when the disease is already advanced. The usual presentation symptoms are either they present with bloody and vomitus, or they present with black stools, or they present with ascites, which is fluid in the abdomen, or they are brought in altered sensorium. Okay. So these are the 3-4 main symptoms with which the patients are brought to the emergency department. Okay. Regarding liver carcinoma, again, patient present at advanced stage, and then we have very limited treatment facilities, so it is difficult to treat them.
And liver transplant is not an option over here, or does it work?
Yes, it is available, but it is very expensive. Okay. And
not very successful either, right?
Yeah, but considering the cost and all these things and the disease burden, it is very difficult to offer it to everyone.
So it's always better to prevent than to cure. When we talk about hepatitis, this is hepatitis B and C. Could you mention a little bit about hepatitis A, D, E as well, and how they affect us, and does it have any correlation with this one? Can it be super added, and how it's spread from the orophycal route and everything else about it?
I will specifically mention about hepatitis D because we always talk about hepatitis B and C, we always talk about hepatitis A and E, but I've seen in my practice as well that we don't focus on hepatitis D. Okay. Whenever a patient comes who is positive for hepatitis B, he must be tested for hepatitis D as well. Okay. Because hepatitis D is super added on hepatitis B. All right. It can't stay on its own, it needs hepatitis B virus to stay in your body. And often when I test the patients, they are positive for hepatitis D as well. And that is even more dangerous. Oh. So when someone has co-infection of hepatitis B and D, the disease progression is accelerated many times. Okay. So it is very important to test for hepatitis D as well before starting treatment for hepatitis B. So that if someone is positive for hepatitis D, he or she must be treated for that.
So and there is a specific treatment for hepatitis D that's different?
Yeah, for hepatitis D, we use interferon injection. Okay. And for hepatitis B, we give oral antiviral medicines. So it is very important to test for hepatitis D. Hepatitis D route of spread is also the same as hepatitis B and C. Regarding hepatitis A and E, they cause acute hepatitis, and the patient usually present with very obvious symptoms like jaundice, vomiting, body aches,
Pale
fever.
stool,
Yeah.
dark
So
urine.
it takes around 4 to 6 weeks, and there is no specific treatment. You only need oral supportive treatment. In some cases, you admit the patient in severe disease.
Okay.
It is not that it is
Harmless. It's not
harmless.
harmless.
Yes, sometimes when it gets complicated, people land in ICU. So
Okay.
it is very important to avoid its spread also.
So what is the spread route? Orofecal, is it the food that we eat outside, unhygienic food? Is the reason?
Regarding hepatitis A and E, the route is fecal-oral,
Okay.
and the most important source for it is polluted water.
Okay.
So people should avoid
Contaminated water, they should boil it and use it and drink it. And what about children? A lot of children are born with a lot of jaundices. What is the reason for this?
As I mentioned, the main source of spread of hepatitis A and E is polluted water.
Okay.
So we should be very careful, and we should use either boiled water or mineral water, and this is very easy to prevent.
So how do you test that the water is contaminated or not, and what would you say about the water in Islamabad and adjoining areas, the water that we get in our supply? Is it fit for drinking and consumption, or do we really need to do something about it? And if you suggest bottled water, then how do we know this is the best bottled water and it's not going to be contaminated?
We have a lot of patients with hepatitis A and E, so obviously we can't say that the water is
very fit for consumption.
Yeah.
Yes.
So it is. I think the best option will be to use boiled water.
Okay.
So and to avoid if you go outside, like on roads and
to avoid raw food.
Yes.
We should be going for cooked food and not these around, all these drains and open nalas that we see.
Yes.
So
And you can very easily avoid spread of hepatitis A and E by just avoiding these
things. And if somebody does contract hepatitis A and E, then what should be the precautions? Should they take a lot of fluids, and what are those things? And they say, put the baby in the sun. Does that work? What is all of that about?
About acute hepatitis, when you have already got acute hepatitis, the treatment is supportive. There is role of fluids, so you must use a lot of fluids, but again not from roadsides. You must use fruits, juices, fruits, but make sure that it is clean. About the thing you mentioned, that put the babies in
sun and phototherapy.
Phototherapy has a role, but that is different thing. Like
that's the other kind of
newborn
jaundice.
baby.
Yeah. So that has no connection with this kind of hepatitis. So that's just jaundice because of being a newborn baby. Okay, and how would you actually, advise everybody out there to take care of their liver health? So what is ideal for the liver? Because a lot of things like milk thistle, it's very common. They say that, these things are good for liver health, and we have a lot of supplements or medicines in the market that are marketed as ideal for liver health. So what is good for a good liver?
You rightly mentioned that a lot of things these days are available, and they are being marketed as supplements for liver. But I think more important thing is to avoid the things which cause liver damage. For example, you should avoid unnecessary drugs. You should avoid herbal desi medicines unless you don't know what are the ingredients. You must avoid alcohol, you must avoid smoking, fatty foods, junk food. These all are lead to fatty liver. So when you have fatty liver, that is one threat to liver, and and then you get hepatitis. Then there are risk factors are added, so the obviously
danger is more. So a lot of people self-medicate these days, and they're Google doctors, and they say, oh, acetaminophen or Panadol is very safe, and they overdose it. So could you please stress on this, that there are so many medications, even if it is Panadol, it can actually be toxic for the liver if you do it in overdose, and also that people are taking a lot of these fat-soluble vitamins on their own. For example, they're taking vitamin D, E, and K on their own. So this can be also harmful for the liver?
Yes, definitely. Drug-induced liver injury, this is a term used for the liver disease caused by different drugs. We must avoid self-medication, and any medicine, even Panadol, acetaminophen in high doses is not safe for liver. and there are drugs which are specifically hepatotoxic and which cause liver damage. So we must avoid self-medication, and we should only use medicine prescribed by a doctor.
And vitamins as well.
As I mentioned earlier, that these supplements and these things you should not use unless
prescribed by a doctor, unless you're established as deficient in them. And these heavy metals, a lot of these kushtas or formulations from our hakims, unfortunately, because they don't have what is there in the ingredients, and they have a lot of heavy metals in them, and people are taking them for vitality and potence and all of this. So could you tell them that this can be very, very dangerous for you as well?
Many times we get patients with liver disease, we test them for hepatitis, we do the ultrasound, blood tests, we even work for autoimmune diseases. They are negative, we don't find any cause. Even their biopsy does not show any cause. So that is very complicated scenario, and I believe this Hakimi medication and these things, that is the cause. When you work up for every cause, but you don't find any cause. So these are the things which lead to.
So what is the reason for so much of fatty liver? Everybody in our society, is it our diet, is it our sedentary lifestyle that everybody has this non-steatotic fatty liver disease? Why is that so common?
It's, I think, because of our lifestyle, sedentary lifestyle, and our eating habits. We are fond of junk food, and now it is a term is used, MAFLD, metabolic. It is the same spectrum, like diabetes, fatty liver, they all belong to same spectrum. So we must do exercise, and we must avoid junk food, and keeping ideal body weight, that is most important to avoid fatty liver.
And this fatty liver, it can be detected on a fibroscan. Is that the way you detect a fatty liver? And then are there any medications for it? Like, for example, if cholesterol or TGL is raised in your heart, you take fibrates or statins. But for the liver, do you advise some medication to reduce its, fattiness?
Fatty liver is even picked on ultrasound, and your LFTs also indicate that you have fatty liver. Regarding treatment, there are no specific medicines for fatty liver so far. The important thing is to avoid junk food and weight loss. That is most effective. Coffee consumption, studies have shown that coffee consumption has a very important role.
So it's good for fatty liver?
Yeah, it's very good for fatty liver.
Okay. And what about the thing that I mentioned before, this milk thistle? Does it have a role?
These all are they are just supplements. They can provide some support, but it does not that it will prevent hepatitis.
And what about the siliver or
these all things are liver tonics, but it's not that they will treat hepatitis or any. They can provide some support to your liver. But
so what are the primary functions of a liver? Because a lot of people don't understand that so much of synthesis of clotting factors and vitamins and proteins and God knows what not goes on in the liver. So if their liver is damaged, this is all that will happen, because they primarily think it's just aids in digestion. So could you just shed some light on that?
Yes, liver is a very important organ for body, and I think it's just like an oil filter in the body, oil filter in the car. It cleans the toxic material. That's why when your liver is not working, people get altered sensorium, and which we call hepatic encephalopathy. Apart from that, lot of synthesis of clotting factors and all those things you mentioned. But more important thing is cleansing the blood.
Okay. So the most important thing is that if you need your blood to be not toxic, you need to have a healthy liver. So what else can we talk about in terms of liver health, as you would suggest to everybody? One is regular screening, other is, you said, diet and exercise. One message pertaining to liver before we move on to the other gastric parts of the body.
I think avoid unnecessary injections. That is the most important, considering our community habits and these things. Avoiding unnecessary injection is the most important thing.
And going for repeated screening, avoiding unhygienic conditions, especially in places of parlors and surgeries and everything else. Now moving to a very important topic is, we have so much of dyspepsia in our part of the world. Everybody comes with heartburn. They're saying we have heartburn, we have nausea, we have dyspepsia, indigestion. What is the most common reason? Is it really peptic ulcer? Because that's most known, and then people start saying, oh, I have Helicobacter pylori, H. pylori. So could you actually bust the myth about this?
Yes, dyspepsia is very common. A lot of patients present with dyspepsia, and they say that we have peptic ulcer, or they just assume that they have peptic ulcer. Dyspepsia does not mean necessarily that you have ulcer. there is no test to know that you have ulcer until you do an endoscopy. So people who have never got endoscopy, they just have symptoms. You can't say that you have ulcer because that adds to their stress.
Exactly.
And a lot of people have functional dyspepsia and IBS that is related to basically stress. So when they assume that they have ulcer, it adds to their stress and they got stuck in a vicious cycle.
So this our bowels are so related to our stress mechanism, and that's why a lot of people have IBS these days, right? So, but could you specify what exactly is H. pylori? How do you test it? Because you need a breath test and all that. And is there a proper, triple regimen or any treatment for H. pylori to eradicate it instead of just taking, random medication?
H. pylori is one of the causes of dyspepsia. But it does not mean that only H. pylori is the cause. Sometimes there are 2-3 factors, like it's your diet, it's your stress level, your smoking, maybe any other thing. So you have to rule out what is the, first to identify what is the cause of dyspepsia. That is most important. After that, if you are positive for H. pylori, it's a bacteria which lives in the stomach. And you can get it treated very easily. It is not something very dangerous as much the
as
people
it's portrayed.
as it's portrayed, and people get serology test.
Okay.
Once you are positive for H. pylori, it will always be positive because it's antibody.
Okay, so it's come in the test.
Blood, yeah.
Okay.
So people get tested. They are repeatedly getting tested for H. pylori in blood, and that adds to their stress that it's still positive. So that leads to functional dyspepsia, and that adds to anxiety. So the important thing is, if you want to get tested for H. pylori, get proper test. Like you can get H. pylori stool antigen test or urea breath test. And for that also there are some precautions which you have to take before getting those tests. Like you should not be on stomach medicines or antibiotics for 2 to 4 weeks before getting tested.
Okay.
And when you are positive for H. pylori, you can get eradication therapy. Different regimes are available, and they are very effective.
So this is all about H. pylori, but if somebody does have, for example, a gastric ulcer or a duodenal ulcer or whatsoever, how do you detect that, number one? And number two, the use of NSAIDs. We take a lot of pills, randomly, and are they responsible for actually aggravating these ulcers and our spicy foods and all of that as well?
Yeah, NSAIDs and especially steroids, they are the most important cause of dyspepsia and ulcers also. And if someone has gastric ulcer, we confirm it via endoscopy, and if there is actually an ulcer, we take biopsy. And that biopsy determines the cause of ulcer. We rule out that this is not malignant ulcer, and then we treat accordingly.
Okay. And what about, this was about dyspepsia. What about the other things like GERD? For example, your food coming upwards whenever you eat it, and there's this feeling of acidity or heartburn, and food coming regurgitating upwards. So what would you advise for someone with GERD? Because a lot of people over here take a lot of these proton pump inhibitors on their own as well.
Yeah. Yes, you rightly mentioned that GERD is also very common. And those patients who are living with GERD, it's better to get themselves evaluated once. And regarding treatment, yes, they are given proton pump inhibitors, and along with that some motility drugs to improve the motility of stomach.
So how are antacids? Are they good for your gut health? Antacids, the rule of repeated antacids?
That depends on what kind of stomach disease you have. Okay. Like if someone has severe dyspepsia, or someone has ulcer and you don't give antacids, obviously that will lead to ulcer, and that can lead to further complications, like a patient can lead to death even. So you have to weigh accordingly. Okay. And regarding GERD, there are some lifestyle modifications which are very important, like again weight loss.
Not sleeping flat.
Not sleeping flat. You can elevate your head end of the bed. And most important thing is there should be at least 2 hours gap between your dinner and your lying down.
And not eating a very heavy meal at once as well. Okay, and what about these proton pump inhibitors? Do they have some negative effects as well? Because a lot of people simply have an addiction towards taking them.
Yes, proton pump inhibitors, they themselves have side effects also if taken for long. But if you have some stomach disease, so as I mentioned that if you have severe dyspepsia and you are not taking them, that can lead to ulcers and further complications. Okay. So when you have stomach disease, you have to take them, there is no other option. but for long without any indication, it's better to consult your doctor.
What about bloating? Almost everybody I know has a severe problem of bloating, and then the moment they eat something, they bloat to like thrice their size, and then some doctors say it is IBS, others suggest something else. So what are the red flags in case somebody is having bloating and associated, either they have weight loss or some kind of rectal pain? What does that suggest, and how do you rule it out? And if somebody has IBS, how do they cure it?
Regarding all these, not only bloating, all these GI symptoms, there are a few red flags which everyone must be aware of, and these include blood in stool, black colored stool, unintentional weight loss, dysphagia, which is difficulty swallowing food, and these are a few red flags which must be.
And how are they investigated, these red flags, if you have them?
If someone has these red flags, the important test is your blood investigations, which include your blood complete picture, because that is very important. It gives clue to a lot of things. Then your ultrasound is very important, and then depending on the source, we usually go for endoscopy or colonoscopy, and that is very important, especially if you develop bleed or colonoscopy.
So are the symptoms of like gastric carcinoma or your gut carcinoma, intestinal cancer, very similar, and what is the prognosis for each of these cancers?
Actually, upper GI and lower GI symptoms are different. With upper GI, you will have black stools, because by the time blood reaches rectum, it will be dark. Yeah. In lower GI carcinoma, the blood will be fresh in color, because the source is in the lower GI. So, regarding lower GI, constipation, diarrhea, and fresh blood, these are the signs. For stomach carcinoma, you usually have black stools or vomiting with blood, fresh blood in vomitus, and weight loss.
If these are detected early, how is the prognosis? Are there treatment options available via surgery, radiation, chemo, and is it, is there hope?
Yes, there is definitely there is hope if they are detected timely before the disease is not spread and you picked it. It can be treated.
Okay, and what about IBS? A very, very common topic, because we are so under stress all the time and we are so worried, and a lot of people have this alternating constipation, diarrhea, bloating, all of this. So how do you go about treating IBS?
IBS is very important, because a lot of people when they have GI symptoms, they assume that they have IBS. But one important thing I must mention is that IBS is a diagnosis of exclusion. It's not wise to assume yourself that I have IBS, or to label a patient as IBS, unless all the diseases, all the other causes, important causes have been ruled out. So that is most important. So if you have any GI symptoms, better to first get yourself evaluated by a doctor before assuming that you have IBS. Because if you will assume that I have IBS and you will keep living with the symptoms, you may develop complications of, and you may reach the doctor by the time the disease is already advanced. So the important message is not to label yourself as IBS unless other diseases have been ruled out. And regarding treatment, if after all the investigation, all the causes have been ruled out, all the investigations are normal, and you are sure this is IBS, then symptomatic treatment is given along with some, depending on the symptoms. Sometimes we use antipsychotic medicines also, anxiolytics also, and even we go for CBT and hypnotherapy and
these things. So these relaxation techniques like yoga, Reiki, or distracting yourself and actually working on your mind does help with IBS?
Yes, definitely. But once you have made sure that this is IBS, is not some other disease. Because I have seen a lot of patients who have been assuming that they have IBS and they have hemorrhoids, and especially perrectal bleed is very important. I have seen many young patients who had perrectal bleed, and it's a myth that every bleed is due to piles, so they keep taking herbal medicines and desi medicines. Yes. And when I scoped them, it was something else.
What about gastroenteritis, the most common? We've come to it in the end, but why do we have so much of gastroenteritis, and what is the right way to treat it, and how important is the role of hydration in all of this, especially in children and adults as well?
Yes, gastroenteritis is very common, and again it is mostly due to contaminated water and food. So the important thing is, if you get gastroenteritis, the most important thing is hydration. Even if you don't take any medicine, it will get better itself. But the important thing is to keep yourself hydrated, because it can affect your kidneys, and people go into kidney failure even, and dialysis also. So the important thing is, sometimes the doctor prescribe you medicines, but hydration is most
So
important.
before any antibiotic or before establishing if it's viral or even bacterial, you need a lot of ORS, right? So what is the ideal oral rehydrating solution if you don't have those sachets available? How do you make it?
If you can get ORS, that is better in a way that now it's available in different flavors. That when you ask someone to take one liquid continuously, same flavor,
get bored.
they get bored. They don't use it.
Yeah.
So one advantage of now the ORS is that there are different flavors are available, so people can switch to different. If you don't have that, you can simple use boiled water, and you can put some salt and sugar in it, and you can make homemade.
When
kind
somebody
of
has
ORS.
diarrhea, we have a tendency to stop all the food for them. So do you suggest stopping all the food all of a sudden and taking drugs that stop the diarrhea, or let the diarrhea happen freely and then you can actually take something like a probiotic, yogurt or rice, or a soft diet?
Yes, this is very common to take antidiarrheals, but that is not an advice unless you have some emergency, like you have to travel somewhere, or if the diarrhea is so much that you can't replace the water.
Exactly.
In those cases, antidiarrheals are used. Otherwise, you should take probiotics, and you should keep good hydration.
What about probiotics? A lot of probiotics are available in the market, but they're saying that yogurt is good or some other. What are the other sources of a good probiotic for your ideal gut health?
Probiotics, a lot of probiotics are available in the market, but some foods like especially yogurt and banana, they have probiotics, and you can use them.
So banana and potassium is actually good for a bout of diarrhea. And if somebody is having uncontrolled vomiting, what do you suggest to them?
Again, hydration is very important, because whether it's uncontrolled diarrhea or it's uncontrolled vomiting, both lead to dehydration that affects the kidneys and can lead to kidney failure. So hydration is most important. If you can't, if you're throwing up everything and you can't, then obviously you can, in that case you will have to go for IV medications.
And now talking about little children and their colic. A lot of children are unable to sleep. They don't let their parents sleep, and they're very, very colicky and yelling all the time. What is the reason for this colic, and how do you cure it in babies especially?
Usually the cause is powdered milk. And you can different formulations are available for colic. If there is no disease, as like in adults IBS is ruled out, in babies it must be ruled out that there is no disease, then those medicines can be used, and that's all.
So this gripe water and all of that, is that, or the use of for example certain herbs, is it good, like using kahwa or green tea or cinnamon, or the different kinds of
green tea and these things, they are all good, and they are advised by as well. But regarding herbs and different formulations, I will not recommend unless you know the ingredients.
So for children, is it good to put them on their back and burp them? Is that very important for them to release the gas, or is that
No, it is just a myth.
So you don't need to burp them?
No.
It's okay. What about gas in adults?
Again, it's more of symptom of anxiety, and it's not necessarily that you have to pass it out to feel that the food is digested.
So this simethicone and peppermint oil tablets and all that, is that good for a lot of gas? And people eat a lot of gassy foods at times. They eat very fast. They use straw or chewing gum. So would you suggest they stop doing that?
Yes, these are recommended, and they are used in that case.
Okay. So one message as we wind up. Thank you so much, Dr. Hyder. One message regarding hepatitis, because today is World Hepatitis Day and we're wearing green just to signify this important day. So one message for our audience out there.
I think taking advantage of this day, we all must get screened for hepatitis B and C. Simple hepatitis B and C screening test. Even you can get it done from government hospitals. And I think that will serve the purpose of this day.
Since we are talking so much about endoscopy, Dr. Hyder, so let's move to your endoscopy procedure room, where you can explain to us in detail what endoscopy is, how much time does it take, and how it is not a terror to be scared of. So let's move there. Dr. Hyder, we were speaking about endoscopy. So what exactly is this? How long does an endoscopy take, and is it something to be scared of?
This is endoscopy machine, and these are different scopes. Like this is for upper GI endoscopy, and this is for lower GI endoscopy. And there is nothing to be scared of. And upper GI endoscopy usually takes 8 to 10 minutes, and lower GI endoscopy that takes average around 40
So
to
that
45
entire
minutes.
scope goes inside you via the oral or rectal route, and you see it on the screen. And is the patient like anesthetized or numbed, or how is it? How does it work?
Yes, patients are given sedations, IV sedations, and patient remain usually comfortable.
And they're not, it's not painful even afterwards?
No, it's not.
So what is the preparation before an endoscopy? What do you tell the patient to be doing before they come for an endoscopy?
Before upper GI endoscopy, patients are usually advised to be fasting for at least 4 to 6 hours, and no other preparations is needed. Regarding lower GI endoscopy, because you need clean bowel, as you have to examine the whole bowel, they are advised not to take solid food, and they are giving some laxatives so that they get diarrhea and all the stool is flushed out. And by the time they come for colonoscopy or lower GI endoscopy, the gut is clear.
And how long does this entire procedure take?
The entire procedure of colonoscopy takes around 45 minutes, and it's around 1 day preparation before the procedure.
And after that, do you need any post-operative care or retention? Or
No. Patient can
just go home.
resume their normal activities
And
just
nothing,
right after the
nothing
procedure.
is like eroded inside
No,
them.
nothing.
So it's perfectly fine. So you would be advising endoscopy to everybody who has these symptoms, especially, and to any age group particularly?
I will be advising endoscopy and colonoscopy to patients, especially those who have red flags.
Okay. And those red flags would be like stool in the,
Like
blood in the
blood
stool.
in the stool, or black colored stool, or weight loss, unintentional weight loss, or difficulty in swallowing stool, or prolonged diarrhea, prolonged constipation.
And have you detected any sort of, things in this endoscopy that people did not have any symptoms, and then you did an endoscopy for them, and did you actually detect something that helped them detect in time?
Yes, most of the times we detect something when patients don't have very obvious symptoms, but the disease is in the very initial stages.
Okay. And that was not available or not detectable on any other test?
Yes.
And then after that, they are able to go for surgery and get a complete treatment?
Yes.
All right, Dr. Hyder Abbasi, one closing message for our audience out there. Since it is World Hepatitis Day, 28 July, and we are celebrating it today, wearing green and commemorating liver health, one message for our audience.
As today is World Hepatitis Day, so I think taking advantage of this day, my message, my request will be to get screened for hepatitis B and C. And you don't need any expensive test, you just get screening test for hepatitis B and C, and you can get it from even government hospitals.
Thank you so much, Dr. Hyder. You heard it. We had with us hepatologist and gastroenterologist Dr. Hyder Abbasi, and he said the only way to fight this silent killer, this latent disease that has actually plagued us all over, is to get tested in time. Timely screening, timely diagnosis, and complete treatment is easily available all over Pakistan. Go and avail it so that we can fight this disease forever. Thank you so much for watching, and inshallah next week you can watch us again. Thank you so much. Allah Hafiz.